Hello and welcome to Juvenile Arthritis Explained. My name is Corinne Pinter. I'm a mom of a 15-year-old girl, Emily, who was diagnosed at 2 with juvenile polyarticular arthritis, and she today has psoriatic arthritis. Today we have with us, our guest is Dr. Leslie Favier, a pediatric rheumatologist at Children's Mercy Hospital. Dr. Favier is also a clinical assistant professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Thanks for being here.
Thank you so much for having me.
Can you briefly walk us through what a typical pediatric rheumatology appointment looks like?
Yes, absolutely. I kind of phrase it as, especially the early appointments, it can feel almost like you're drinking out of a watering hose. Like there's just a lot of information, a lot of things you feel like you need to keep track of. But if you kind of, as you go along and go through more of these appointments, you learn kind of the rhythm to them. Oftentimes, even before you step into the building or maybe in the waiting room, you're provided with some pre-visit questionnaires often that can ask about functioning, some of the symptoms ahead of time, even questions about other body systems like, headaches, abdominal pain, general health. Oftentimes we'll try and get in questionnaires ahead of time. And they are actually important because we will look at them before we even step in the room with you and kind of get an idea of how we kind of need to kind of flow the appointment. The next step is, going into getting checked in. We get vitals taken. Sometimes with these little guys, we want to explain, we're going to be getting blood pressure. They're going to measure your heart. They're going to take your temperature, those kind of usual doctor's appointment visit parts. And then getting back into the room, you'll meet with nurses and, a nurse who'll get an update on history. And then you'll see the rheumatologist or rheumatology provider. And that's when this is the fun part, is when we catch up on history. We, of course, talk about symptoms and the goals of the visit. We also get to bond with the kids. I always like to hear, what's going on in school, what sports are we into, musical instruments, hobbies. That's kind of the meat of the appointment, right?
Right.
And then oftentimes we'll go into our physical examination after the history. So for juvenile arthritis, I still do the usual, listening to heart, listening to lungs, all the, looking in the mouth. But we also do the head to toe musculoskeletal exam, looking at skin, seeing how our joints and our muscles move. We often will have the kids walk to see how their gait exam is. And then after we've gotten the physical and the history done, that's when we have our, shared discussion about our goals, our plan, if there's blood work that's needed, additional imaging that's needed, and then we can talk about if there's medications, what those look like, and go from there. But it can be a process, maybe a little bit longer than most, I would say, physician appointments go. I don't know if you agree.
Right. It's more than a well check
Oh, yeah.
in that case. Yes. And that comes to, you did say, all the vitals. So it's going to look very much like a doctor's appointment. But then, like when you said about the physical exam, like you go into that a little bit more in depth, past, listening to the lungs, looking in the eyes, opening the mouth, checking the ears, the normal. Then it's like, okay, let's start looking, like you said, from head to toe. It's really a comprehensive look at the different joints and movement and flexibility and range of motion. So that's what, as a parent, I noticed was different at first. Like, wow, you really are looking at everything. Fingernails, toenails.
We're very detail oriented people. So
Yes, which is good. So it's a very detailed appointment. So parents know the detailed appointment. This isn't a fast appointment. This is getting looked at. So from your perspective as a pediatric rheumatologist, what does the quote unquote ideal appointment look like for you?
Yeah, I think the probably most important thing for me is comfort, for definitely the child, but also the family, the parents who come. So that's my biggest concern, or, goal, is to make sure that everybody's comfortable, everybody feels heard, communication is clear. and that our goals are achieved. So I can do my exam. I can clearly think through, what I'd like to offer and communicate with the family. They feel heard and listened to. And
Right.
then it's a seamless connection when we come together and make our plan. We all have the same common goal to achieve remission, right? So
Right.
that's, I like to have this happen as smooth as possible. Everyone feels like we've accomplished something after the appointment's over and that we're content.
And that makes, I like that you said that everybody's like collaborative, working together to come to the same end endpoint. And that's why even when you said the before getting into the room, if you get surveyed or something like that, when things are put into the surveys or the questionnaires, that's important that the patients and parents give you, symptoms, pain, anything going on that they can think of, so you have a good idea coming in and you're prepared. So you see that some of the issues that may be needed to get looked at. But also during the appointment, I think it's important for parents and patients to know too that if something comes up, like have it jotted down and you could also bring that up. It's not just, we forget it, especially those first appointments are very overwhelming. And a lot of times we don't have, it's very an emotional driven appointment. So a lot of times a lot is forgotten, and that's okay. It's still okay to discuss that, you know, we'll remember and we say it.
And I think that's the idea, right? So we're trying to
Yeah.
catch things with a questionnaire up front. We
Yep. Yep.
hopefully, if parents come prepared with their thoughts, and then we
Mhm.
can sometimes ask another. So it's kind of a net to catch all of these things,
Yes.
facts, right?
Yep. Yep. I always have a notebook. I have everything jotted down from the previous appointment and then the current appointment. And then if anything comes up in between, so that we forget it. Our brains can only hold so much information, and we're trying to do it all at one time as well.
Especially as moms, yes.
Yeah, especially as moms, right? Okay, so as far as frequency of appointments, how often should in-person appointments be scheduled? And what factors might influence a change in these visits?
Yeah, so this is always going to be kind of a plan that's spoken between you and your provider, and they're going to update you as things change, right? So, a lot of our juvenile arthritis patients, we want to make sure that we're seeing them often enough to make sure their treatment is helping, and that we're on the right course. Um, but we also want to leave time for our medications to really work too. So we don't often have, every 2-week appointments. Usually there's a little bit of time to kind of make sure that the medication has enough time to get working. We also take into account lab monitoring too. Do I need to do blood work, and you're going to be coming into the hospital anyway? Should we just do an exam and kind of catch up and see how
Mhm.
things are going? If a child is flaring, we're going to need to increase the frequency of the visits, though, because that's what we use to guide our treatment and make sure that what we prescribe or the plan of action, the physical therapy, the medications, that they're working and that they're doing what they're supposed to. Other things we consider are, distance from our site. So if you live really hundreds of miles away, I may be a little bit more flexible with our time. Um, and frequency of visits. But otherwise, that's kind of how it works. Yeah.
I know we've gone pretty regularly, like the 3 to 4 month mark, and sometimes we've had to do it in between for labs, depending on if we've started new medication or not. And then sometimes we get to a point where they can be stretched out further.
Hmm.
Um, and then sometimes we have to go back to our regular scheduled routine. So there's times when condition will change and appointments might change.